Oh,
Morning,
good morning,
Bianca.
everyone.
Hi, Bianca.
Morning.
Good morning, Rana.
Hi, good morning.
Good morning, Gabby.
Good morning.
Good morning, again. The crowd we have this morning.
I'm coming from a medical appointment and it's raining like crazy. So I'm hoping everyone there is safe.
Oh, goodness.
Be safe, please.
Yeah, the rain hasn't hit us yet.
Oh, okay, West Valley is crazy.
Send it to the East Valley. We need some of that out here.
Yeah.
Not in Tempe yet, so that's good.
Okay.
Also, John, I texted Wendy saying good morning.
Sorry, say that again.
I texted Wendy saying good morning.
Oh. Hey, one week to go, Sophie.
Good morning. Good morning, JJ.
Morning out there, everyone.
I had to say good morning to my Swiftie friend. Obviously, John, get to the program.
Yep, that's right. 1 week from today.
1 week from
All right.
today. We got this.
That's right.
Yes.
Well, we only have a couple people who are missing this morning.
Yes, we are waiting for JC to arrive here at the office with some guests. And we have a couple of people who aren't going to be here today, but otherwise I think we're good.
You have 15.
Okay, wait. 1, 2, 3, 4, 5. And Megan. Oh, I thought we had 18 now with, unless I double counted. Hi, Megan. Let's see. Yeah, I listed somebody twice in here. Well, we do have quorum.
Sorry to be joining late.
That's okay, Megan. Thank you. John, do you want me to wait for JC? Do you want me to go ahead and get started?
You know, in the interest of getting through everything on the agenda today, we probably should go ahead and start.
We have a very heavy agenda with all of our grants to approve today. Well, good morning, everybody, and welcome to our full council meeting for Friday, September 26th. I will call our meeting to order at 10:04 a.m. Thank you so much. Marcy, would you like to do roll call?
Sure, absolutely. Good morning. I will start with Melissa.
Good morning, everybody. This is Melissa Van Hook. I'm chair of the council and then also chair of the Meaningful Careers Committee.
Thank you. Monica.
Who did you call?
Monica Cooper.
Oh, me, Monica Cooper, self-advocate, chair of the grants committee.
Okay, thank you, Monica. Megan.
Megan Cox, guardian and sibling of a brother with IDD, and also on the.
Great, thank you very much. Bianca.
Good morning, Bianca Demara, family representative.
Okay, CJ.
Sorry, having trouble with my camera. Good morning, CJ Lucille, access representative.
Great, thank you very much. Kathy.
Good morning, Kathy Lewandowski, family member, chair of the work review committee.
Thank you. Kristen Mackey.
Hello, everyone. Kristen Mackey, council member and administrator for RSA.
Great, thank you very much. Jana.
I'm with you, CJ, having a little trouble with my camera. Hi, good morning, Jana Merle, chair for the Systems Access Committee and also representing Encircle Families. Good morning.
Thank you, Jana. Gabriella.
Good morning. Good morning, Monty Josh, council member, president for Ghana, and trying hard to drive in very heavy rain. Good morning, everyone.
Good morning. Well, be careful. Thank you. Kelly.
Good morning, everyone. Kelly Roberts, Executive Director of the Institute for Human Development at Northern Arizona University and on various committees for ADDPC. Nice
Great.
to see everyone. Thanks.
Thank you, Kelly. Vijette.
Good morning, everyone. Vijay Sari and Family Representative.
Great, thank you. JJ.
Morning, everyone. JJ Rico, Vice Chair of the Council and CEO for Disability Rights Arizona.
Terrific. Mateo.
Good morning, Mateo Treetop, Self Advocate.
Great, thank you, Mateo. Sophie.
Hi, good morning. I am in a feeding company and we are doing animal assembly and I just got the lead.
Thank you, Sophie. Eric.
I have to turn off my mic. Eric Jensen, community member and disability advocate.
Thank you, Eric. Raina.
Good morning, everyone. Council member Raina Sims. I'm with the Department of Economic Security, Division of Aging and Adult Services.
Perfect. Thank you very much. Are there any other council members that I missed before I move on to staff and guests?
Farkas is here in person.
Marcy, JC just arrived. Sorry, I missed you. Yeah.
Welcome, JC. Thank you.
Hi.
All right. Let me move on to staff. John Myers.
Good morning, everyone. John Myers, Executive Director of the Council.
Thank you. Michael.
Good morning, everyone. Michael Leva, Contracts and Grants Coordinator.
Lonnie.
Good morning, Lonnie Saints here, Fiscal Manager.
Sarah.
Sarah Roof, Communications Director.
Great. And Jason.
Jason's name, Research Communications Business.
All right. Thank you. And I'm Marcella Crane. I'm the Contracts Manager. I am going to move on to some guests that I see here. April Jones.
Good morning, everyone. April Jones, Department of Economic Security, Office of Community Engagement. I'm here to support our team.
Thank you. Wonderful to see you. Thank you. We have an intern with us, Alexander Martinez.
Good morning, everyone. Alexander Martinez. I'm one of the MSW interns with the council.
Great. Thank you. Another guest, Jesse Barbosa, who used to be a previous council member.
Hello, everyone. Jesse Barbosa. Oh, there we go. Previous council member awaiting reappointment, member of the community, disability rights advocate, and currently work at Disability Rights Arizona.
Terrific. Thank you. And we see a couple of phone numbers, but I'm not sure exactly who everybody else is. That's it.
Marcy, we have a couple of guests here in the conference room as well, Marcy.
Okay.
Do you want me to do this?
Well, we have, I'll let them introduce themselves, but we have two visiting professional fellows with us from East Africa. Calvin, do you want to just introduce yourself?
Yes, thank you. My name is Kelvin Emmanuel Mkude. I work with persons with disabilities in my country. I'm from Tanzania as an executive director and the founder of Winning Nature in Charisma. Thank you.
My name is Mary Dangote. I work with young people who have spent half all of their childhood in child care institutions. I come from Uganda.
Thank you. You've come a long way to be here. All right, Marcy, I think that's it.
Okay, Melissa, back to you.
Okay, Marcy, thank you so much. I appreciate that. Okay, let's move on to agenda item B, the minutes review and approval from our meeting from June 27th, 2025. I hope everybody has had an opportunity to read the minutes and take a look at them. Before I call for a motion to approve, are there any comments or corrections or changes that need to be made? Okay, hearing none, I'm going to call for a motion to approve the minutes as written from June 27th, 2025. Do I have a motion?
Aye.
Is that Sophie? Thank you, Sophie. Do I have a second?
This is Vijay. I'll second that.
Thank you, Vijay. All those in favor of approval, please say aye.
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 All those opposed, please say nay. Is anyone not voting? Okay, thank you so much. Motion approved. Agenda item C, our fiscal contract update with Lonnie St. Cyr, our fiscal manager.
Thanks, Melissa. John, would you mind sharing the document? It looks like you
Yes.
have it open.
Whoop, 1 second.
If it's a pain, I can do it.
Nope.
Okay.
See it now?
Yep. Thank you very much.
Hey, Lonnie, I'm sorry to interrupt you. Before we get started, everybody who's called in, if you could please mute your phones because there is some background noise, that would be really helpful. Thank you. Sorry for the interruption, Lonnie.
Oh, no problem. Thanks for putting that out there.
You bet.
Okay, so to begin with, the council received a total allotment of $1,501,328 for fiscal year 2023. A no-cost extension for the period of performance was granted through September 30th of this year, so by the end of the month. The council has fully liquidated these funds, so we're all good with 2023 funds. The council has received a total allotment of $1,500,684 for fiscal year 2024. The obligation period is through September 30th of 2025. So again, the end of this month, the council has fully obligated the funds, so we've met that requirement. The council requested a no-cost extension for the project period, which will allow another year. So it will now run through September 30th of 2026. So we have another year to complete the work. There's approximately $121,497 remaining to be liquidated by September 30th of next year. These are the funds being used for the current 2025 work plan projects. And finally, the council received a total allotment for fiscal year 2025 in the amount of $1,497,106. There's approximately $344,501 remaining to be obligated. And the goal is to obligate these funds with the projects to be voted on during this meeting, so the work can be completed next year and meet the project period deadline. The obligation and project periods are through September 30th of 2026. The final report is due January 28th of 2028. We're not anticipating a no-cost extension for these funds, so it's really important that we meet the period of performance requirement for this year's funds. That's it for this sheet. Does anyone have any questions?
This is Kathy. I don't have questions, but I was looking at the documents online on the council's website, and the fiscal document seemed to have different numbers from what you were saying. So I just want to bring that to your attention because.
What numbers are you thinking are conflicting?
Number 3, council has received a third allotment for 25. How much did you say we received? Because in the document it says 820,000. Did I hear that? Is that correct?
No, I don't think I mentioned 820,000.
Yeah. So I'm just saying that that first page.
Well,
it says it was updated 9/15/25.
Yeah, Lonnie, I think what Kathy's referring to is in point number 3, and the comment number 3 on this page, you say that we received a third allotment for 820,000. That was for the balance of our fiscal year 25 grant award from ACO.
Oh, yeah. So under the comment number 3, that's correct.
Okay.
So we don't get our full award amount in one award letter because we operate under a continuing resolution. We get multiple award letters. So that 820,412 that you see in comment number 3, that was our final award, which brought our cumulative total to $1,497,106. So that was just one of multiple awards.
Okay, so I was just looking at something else. Okay, never mind. Thank you.
So it's part of the 1,497,000 that
Okay.
I mentioned. But again, we got that award, I think, before the last full council meeting. So that's why I didn't bring it up during this one.
Got it. Okay. Thank you.
No problem. Any other questions? Okay, this one I'm just going to keep very brief. This sheet shows all the current projects funded by the council. Staff are reaching out to grantees to get a better idea of what they are anticipating spending. So that way we could process the final invoices in a timely manner. As you can see, many of the projects dropped off at the end of June, and several other projects are ending the end of this month. A few of them have proposals for renewal. Any questions on this sheet? Okay, moving on to the final sheet. This sheet has been updated to reflect the projects outlined in fiscal year 2025 and 2026 work plans, as well as the funding that has already been approved in prior years. The funding year is generally the year prior to the project year. For fiscal year 2025 funds, those funds will be used primarily for projects to be completed in fiscal year 2026, if that makes sense. So 25 funds are for 26 work plan projects. The projects highlighted in yellow are to be discussed and voted on today. We explored contracts that can be awarded by October 1st, so we can meet the period of performance requirement. The administrative budget has been increased to reflect the work to be done with the comprehensive review and analysis. Any questions on this sheet? Okay, that's it for me. Thank you, guys.
Thank you, Lonnie. Appreciate that. Okay, moving on to agenda item D, our executive director report, which on Myers.
Okay, good morning again, everyone. I'll also try to be brief, as I know we've got a lot of grants to go through today. First of all, just wanted to mention again, with regard to council member appointments, I may have mentioned this at the last council meeting in June. We formally have now J.C. Farkas representing the Sonoran Center, one of our USEDs in Arizona. Finally got that through the process. And Jeffrey Studer from the Department of Education. He is the Director of Conflict Resolution at ADOE. He is not able to join us today, but they are both formally appointed to the council now. We do have several people still in the queue waiting to be evaluated, vetted, I guess, by boards and commissions, and we'll keep you apprised as that moves through. Don't hold your breath. It does, of course, take a lot of time. So we'll just let you know. Hopefully, maybe we'll have something by the next council meeting. Also wanted to introduce you to a couple of interns. Alexander introduced himself earlier. We also have another intern named Sharon Wool, another MSW intern. Both of them they have hit the ground running. We are ecstatic to have them working with us during this academic year. They will be here until May of next year. And we've got them working already, and it's great to have them. So we're fortunate that they've come to us and looked for that internship opportunity. Regarding the fiscal year 26 federal budget proposal, we reported at the last council meeting that things were a bit in flux, and there was a proposal. The original proposal that came out from the Trump administration was essentially to eliminate all of the DD Act programs. Since that time, more recently, actually in August, Congress, the Congressional Appropriations Committees met, both the House and the Senate voted to approve level funding for all of the DD Act programs. So the USEDs, the councils, the P&A are all slated at this point to be level funded in fiscal year 26. Of course, that all assumes that we ultimately get a budget for fiscal year 26, and that is up in the air right now. We might see a government shutdown next week. We might see a continuing resolution. That seems to be the odds-on favorite moving into at least the first quarter of the new fiscal year. But it's really anybody's guess right now, because as usual, Congress and the White House are having difficulty coming to an agreement. So, if all things go well, we will see the same amount of funding that we saw this year, and we'll be able to continue the programming as we're planning to do in the new year. I would also point out that level funding proposal from the House and the Senate includes the projects of national significance, which were also slated to be eliminated in the original White House proposal. And that's important to us because our Bridging Aging and Disability Networks community of practice is part of the projects of national significance. So assuming that funding goes through, we'll be able to continue and receive funding for the bridging projects moving into fiscal year 26. Regarding the Department of Health and Human Services, we've also previously reported that there was a proposal to move the Administration for Community Living, which is where we live right now within HHS, into the Administration for Children and Families, and to create a new administration called the Administration for Children, Families, and Community. At this point, it's uncertain the status of that. There was a lawsuit to prevent ACL from being subsumed under ACF. That lawsuit has not been formally resolved, and we're getting conflicting information from our national association about what the status is of that merger, and so we don't really know. As it stands right now, ACL remains ACL, ACF remains ACF, and there is not yet an ACFC. So if our DD network partners have heard otherwise, I would certainly ask them to speak up, but what we're hearing from NACDD is that there really hasn't been any movement on that. It's still uncertain. Access and DDD, I don't think it's a surprise to anybody that some new eligibility requirements came out, or a new assessment tool came out about 2.5, 3 weeks ago from Access and DDD. This is all related to the supplemental funding bill that was passed in the spring in the legislature. What I think may have escaped the notice of a lot of folks in the community was that along with the money the legislature appropriated to keep DDD solvent came some strings. And those strings included forcing DDD to put into place a new eligibility assessment for children aged 0 to 17. And as you probably noticed if you've been paying attention to the media the last couple of weeks, there is some really dramatic concern on the part of families about what these new eligibility requirements are going to mean. And in fact, they're going to mean some cuts for a lot of families. So for the last 3 weeks, I think probably Sarah and I have lost count of the number of hours we spent on telephone calls and meetings. And I think every advocacy organization in the state is working on this. I will be honest with you, there has been some disagreement among some advocates about how to approach it. One advocacy organization encouraged people to contact CMS directly and tell them that Arizona was going to be out of compliance with its waiver. We don't agree with that tactic. We think that was a huge mistake. And in fact, the governor's office had to get involved and ask this advocacy organization to pull that particular call to action, because we're in the process of trying to get our waiver, our Medicaid waiver renewed as it is, and complicating things with CMS is not going to stand in our favor. So we're trying to come to some agreement about how we approach this. The reality seems to be that these changes are going to go into effect on October 1st. They are necessary in order to keep the DD service system afloat in Arizona. Without these changes, there would be some real danger for the system. It is going to impact a lot of families. Some of you may be impacted by this, and that's really unfortunate. We're doing everything we can, working with DDD and with Access to try and mitigate the harms. But the reality is we have a very generous system in Arizona. Everyone knows that. And caseload growth, utilization, they've just gone through the roof in recent years, and there's no way the system could survive if changes weren't made. So we're happy to talk with anybody more about this. We continue to work with our advocacy partners around the state to, as I said, to try and mitigate the harms. It's not going to be pleasant for a lot of folks, but many of these, maybe all of these changes are really necessary, and they were legislatively mandated, and the governor signed that legislation. So the train has sort of left the station. We'll do what we can to help families, and we'll keep you informed as we move forward about what's happening in the community. But every indication is that neither Access nor DDD is going to step back from what they have proposed and what they are going to implement on October 1st. Regarding the fiscal year 26 work plan, we submitted that in August. It was due August 15th. It has been sent in. We have not received an approval for that yet. We certainly would like to get an approval for that because the new fiscal year starts on October 1st, but we haven't heard any word yet from ACL about where that stands. We are proceeding as though it will be approved and as though any changes, recommendations, or what have you will be minor. There are very few differences from what we've submitted in past years, so we expect that it will be approved and we'll be able to move forward. The new state plan development, Lonnie mentioned that our budget reflects some money appropriated for that state plan development. We are working with the Institute for Human Development at Northern Arizona University to conduct most of the work on that. Obviously, we as staff have a role in that, but they are doing most of the heavy lifting, at least at this point. We've had a number of focus groups around the state through the course of the spring and early summer. All of that is done now. The comprehensive review and analysis is in the process of being compiled. We've done surveys. We've done a lot of outreach to the community, and we're now to the point where we are going to start. I think we are very close to starting in on the real meat and potatoes of the plan development. So most of our November meeting, by the way, will be dedicated to talking about the CRA, talking about the priorities that have been identified by our communities, and discussing the role that the council committees, and members of the community are going to play over the next, say, 4 to 6 months in moving us forward on this work. And then finally, the proposed meeting dates for federal fiscal year 2026 were shared with you. They're up on the screen now. They very much follow the pattern of recent years. The only change is over the last couple of years, we've had a November, January, April, June, September cadence. Next year, because of the work being done on the state plan and some timing around getting that out for public comment and then potentially having to go back for a second round of public comment. So we've moved the April meeting to March. So you can see March 27th will be the spring council meeting for next year. We've done our best to look at other calendars and make sure these dates don't conflict with events that may be going on. But if you know of events that are going on, or if these present significant conflicts for you, please let me know. I will be sending out meeting invitations for these various meetings in the next week or so, just so everybody's got them on their calendars ahead of time. And if by some chance any of these dates conflict significantly with conferences or other events, we will do our best to adjust them as possible. So with that, I'm going to stop. I'm happy to answer any questions anybody has. All right. Thank you.
They're all just so stunned from the news, John. From our budget. I'm kidding. Okay. Thank you so much. Moving on, we're going to begin our very long process of contract and grant either renewals or new projects. We're going to start with the grant renewals, and there are 3 of those. The first contract grant and renewal, Marcy is going to go over these. We may have John and Lonnie as well. We're going to take a vote after each grant is reviewed, not wait till the end. All right, staff, go ahead and take it away.
Okay, thank you, everybody. There are a lot of attachments to this. The full proposal is there for anyone who wants to read a lot of detail, and there is a summary of each proposal to give a quick overview, and I will be going over that document instead of the full proposal. I really want to thank all the staff to help kind of put this together in the last 6 to 8 weeks, and really reach out and thank JC Farkas with Sonoran Center, who really endured a lot of back and forth with us. And I know she's here, and really appreciate her and her staff on meeting a lot of our internal deadlines, as well as to Kelly Roberts at NAU, because there's one proposal there. The 3 proposals that I'm going to discuss first are the renewal contracts that are coming in for the additional final year. And the third one is I'm going to have John take the lead on that one. And then after that's done, we'll talk about the new proposals. So the first one up is going to be the A program from the Sonoran Center on the Native Disability Center, which is also known as the Circle of Indigenous Empowerment. This is our target disparity focus that the feds required 5 years ago. It is the 5th year funding coming in for $120,000. The summary, I am just going to highlight just a few of their outcomes and then talk about what they plan on doing going forward. So, and talk a brief history of what this is. So the Circle of Indigenous Empowerment, which is overseen by the Sonoran Center, this grant is particularly just a Native American focused within the University of Arizona. Over the 4 years of funding, the CIA goal was to engage and utilize expertise of partners to assist tribal education workforce programs, parents and guardians of Native people with disabilities. They also work with tribal colleges and universities, as well as state and local organizations and state agencies to increase their knowledge of disability services, help promote advocacy and programs to Arizona's tribal nations. There are 22 in Arizona, as well as off-reservation and urban communities that surround the communities in Arizona. They have also done a tremendous amount of work and collaboration with tribal nations outside of Arizona that participate with them as well. They had 4 key objectives with multiple activities. I will cover each objective and at least one of the outcomes, and just for highlighting and to keep this conversation moving forward. The first objective was to expound outreach and engage with 16 tribal education and health departments and 3 tribal colleges to identify disability and workforce needs. I highlighted 4, but the one I want to cover is the first one. They met with 16 tribal education health departments and voc rehab programs to identify needs assessments of Native youth and adults with disabilities. An example is quarterly meetings that they conducted with 4 voc rehab programs. They met with the Navajo Nation Office of Special Education and Rehab Services, Hopi Tribal Voc Rehab, and the WIA program. Also, they met with the Hona Odom Nation Tribal VR and Child Development and Education Support Services with Gila River Indian Community. The second objective was to strengthen Native youth and adult workforce resources and opportunities in 3 tribal communities. This was the primary target disparity focus for the Navajo Nation. So the CIA, or the Community Indigenous and Empowerment, they convene quarterly meetings of state and tribal programs with VR focus, tribal employment programs, state employment programs, and schools as to discuss the streamlining of the application process for students, as well as cross-eligibility programs. They brought awareness of the challenges and successes, and the CIA also provided technical assistance to build capacity for transition services, leading to meaningful employment opportunities in 3 tribal communities, which are Navajo Nation, the Tohono O'odham, and the Hopi tribe. The third objective was to expand monthly training and continuing education opportunities for key stakeholders to increase their awareness of disabilities in Arizona tribal communities. Between October of 2024 through June 2025, when this proposal was submitted, they hosted 6 webinars reaching approximately 279 participants on various topics. They hosted a focus group with Arizona Department of Health Services that included 8 parents as part of their discussion on the American Focus Group for Title V Maternal Child Health Care Block Grant. They also developed numerous outreach resources that included 5 fact sheets on disabilities, which the fact sheets covered hearing loss, vision loss, autism, assistive devices, and advocating for your student. The fourth objective was to focus collaboration with state and national federal agencies and tribal programs to increase awareness on disability services for Arizona tribal nations. They partnered with the Native American Disability Law Center, which is our other P&A in the 4 corners of the states, as well as NAU, the Institute for Human Development, National Congress of American Indian Disability Policy Work Group, the Consortium of Administrators for Native American Rehab. Meetings of these types are really important to promote a comprehensive network of services to address the diverse needs of Native individuals with disabilities and to address new partnerships or solutions to barriers. Previously, before the change in administrations, they used to meet with the Federal Office of Disability Employment Policies, but due to changes at the federal level, many of these meetings have been canceled. Going forward in their final and 5th year, these 4 objectives will continue, but they updated 2 of them. So the first objective has been updated. So it is still the same, expand outreach and engage with tribal colleges and the universities, school districts to provide information and training sessions on Native youth with disabilities. They plan to expand to include 3 other universities and 4 school districts. Their second activity remains the same, strengthen Native youth and adult workforce resources and opportunities in 3 tribal nations. And they plan on focusing on creating school-based independent learning centers, work-based learning experience, and apprenticeships and leadership opportunities. The third objective is to expand monthly training and continuing education opportunities for key stakeholders to increase awareness of disabilities in Arizona tribal nations. In the 5th year, they plan to expand efforts to create training sessions for parents and teachers. And then the 4th one has been updated to show that they plan on collaborating with state, tribal, and nonprofit organizations to increase awareness on disability services for Arizona tribal nations. They plan to also include a focus on recreation and social connections towards overall holistic health and well-being. Just want to also state that we know that this program has been sustained and has done very well, and we think that the Sonoran Center will continue to work in this area and continue to partner with many of the partnerships that they have worked with in the past, and we continue to look forward to supporting this. Any questions?
Okay. Hearing no questions or comments, I'm going to call for a motion to approve the Native Center for Disabilities Circle of Indigenous Empowerment Year 5 with the University of Arizona Sonoran Center in the amount of $120,000. Do I have a motion?
Aye, Sophie.
Thank you, Sophie. Do I have a second?
I'll second it.
Thank you, Monica. All those in favor of approval, please say aye.
Aye.
Aye. All those opposed, please say nay. Is anyone not voting?
I am.
Mateo? Okay. Thank you so much. Motion carries.
And this is JC. I've also abstained.
Thank you, JC. I was gonna ask you. Okay. Thank you. Motion carries. Thank you. It passes. Sophie, you have a question?
Yeah, so what does it mean that the DDD requirements are changing?
I'm sorry, I couldn't hear that. The DDD requirement, could you repeat that, please?
Yeah, what does it mean that DDD requirements are changing?
For changing. Marcy, do you want to answer that?
Can you clarify what the question is, please?
Yes. What does it mean that DDD requirements are changing?
I think that might relate to what I was reporting on a little bit earlier. Do we want to address it now, or do we want to wait until we get to the end of the grants?
Yes. Sophie, John can definitely answer your question.
Okay.
But we're going to go ahead since we're talking about the grants right now.
Okay.
We will definitely let you know. Okay. Thank you. Thanks for the question. A good question. Okay, Marcy.
Okay, thank you.
You're welcome.
Thank you. The second renewal is the crisis response and trauma-informed care, also submitted from the Sonoran Center for their 2nd year funding for $100,000. Again, I will highlight this proposal from JC's team. This is under our goal safety, and we had many conversations with JC prior to the submission of this proposal. What we wanted this to do was to address a report that was previously done by the council, to use it as a basis for addressing how crisis response and trauma-informed care can be elevated and identified, and more of a focus for a systems change project, as well as outreach and dissemination and really education. And so what they are proposed is to gather, this first year was they gathered research on existing resources and data on crisis response and TIC, which I will just abbreviate, and then to develop and disseminate curricula and resources to improve the practices for the IDD community and the services that support them. During this first year funding, with the assistance of graduate and undergraduate students, they completed the following activities. So they had two focus. Their first focus was trauma-informed care curricula development. Part of the task that they completed is they completed a literature review to identify resources and existing literature on the topics of crisis response and TIC for the IDD disability community. They also developed and distributed a needs assessment survey to identify community interests as it relates to trauma-informed practices and training. They had 54 responses to that survey that they received. They also completed interviews with stakeholders to inform on the TIC curricula development, and that included interviews with Diversibility, DDD, and ACES-DB, which is yours on a, I'm going to completely mess ACES-DB up, but it's our collaborating partner on domestic violence. And then they also collaborated with the Native Disability Community lead program staff, Agnes Ataki, which she developed a working document for the team to reference when they develop curricula and resources that would be relevant to the Native disability community to make sure that it is rooted in historical context, considering the Native community sensitivity around these issues. And then the last thing that they completed is a collaboration with U of A Western Regional Public Health Training to develop a self-paced outline module. The second focus, which they've also completed numerous tasks, include the outreach and dissemination of this information. Dr. Lynn Tomasa, she presented 2 guest lectures that incorporated TIC and disability community in the Sonoran Center's Disability Perspective class for bachelor's in medicine students and other health and allied professionals. J.C. Farkas presented ACEs, or adverse childhood experiences in complex trauma in relation to disability, in 2 classes led by the same Sonoran Center's Disability Perspective for the Certificate in DD Program Community Portfolio courses. And then with assistance from student training interns, they also developed a working list identifying other U of A courses where this content can be included, including at the College of Nursing. Barbara Brent partnered with Self Advocates to develop community resources for people with disabilities families, and they are also collaborating to develop workshops in their second year. The Sonoran Center partners with Disability Rights Arizona at the African American Conference on Disabilities that was just recently held this past June for a mental health care track that included 4 sessions, 2 of which were conducted by the Sonoran Center staff, and then the other sessions were conducted by other professionals. They are on track to completing a few remaining activities at the end of this month, and our office had no concerns. Going forward, as far as their renewal proposal, they are going to build upon what they have accomplished in the first year and propose new activities. I've highlighted just a few in this summary. Their first area, obviously, is to continue to expand trauma-informed care curricula for current and future professionals. They plan to develop and pilot 2 4-hour curricula for disability professionals and healthcare providers. They plan to develop and pilot modules based on foundational curriculum for future disability professionals and healthcare providers in institutions of higher education. So they've already identified 2 courses at U of A that could be taught by Sonoran Center affiliated faculty. So this is really important that we see that they do. And then Dr. Tomasa will work with U of A Forensic Nursing Program to develop a module on how to support individuals with IDD for inclusion in their curriculum. That will be research on the feasibility of offering a weeks-long online course for students and community on TIC. In the second half, which is around education awareness for people with disabilities and families, this is going to be led by Barbara Brent. She's going to work closely with 3 self-advocates and Ability 360 to develop and pilot to implement workshops and accompanying training and presentation materials by self-advocates for self-advocates who have lived experience in this topic. They plan to develop a care guide, and which is an advocacy checklist for people with IDD on what to look for if they need to navigate and receive behavioral health care services. All information developed will be reviewed and approved by self-advocates. And then the dissemination and outreach is partnerships is really with their communication team is to develop more focused stories, shorter conversations, somewhat like StoryCorps videos, as well as perhaps potential podcasts that bring the voices of those that have lived experiences to the public. They're going to create an inventory, what they call a lived experience inventory of case examples that can be used for courses, webinars, and upcoming presentations. They are also partnering with the Pima County Justice Services Advanced Crisis Response and Intervention Training that's coming up on October 14th. And then they are partnering with Disability Rights Arizona and the Arc of Arizona to offer a workshop for professionals on legal options for crisis support, which is to help professionals understand recent changes in the law and how to share this information with families. They continue to do a number of different evaluation methodologies, which is focused to get feedback on all their information from their trainings and their workshops, as well as they're going to do a further post-outcome survey 3 months post a training to capture how participants plan to use the information they learn and provide examples. So our staff feels really good about this proposal on everything they've accomplished in the last year and going forward. Questions that I can answer.
Okay, no questions, no comments? All right. All right, hearing no further discussion, I'm going to call for a motion to approve Crisis Response and Trauma-Informed Care Year 2 from the University of Arizona Sonoran Center in the amount of $100,000. Do I have a motion?
Aye, Sophie.
Thank you, Sophie. Do I have a second?
This is Bajette. I'll second that.
Thank you, Bajette. All those in favor of approval, please say aye. Aye.
Aye.
All those opposed, please say nay. Is anyone not voting?
This is JC. I'm not voting.
Thank you, JC. Okay, thank you. Motion carries. Right, Marcy?
Sure. The next one is the collaborative approach to better respond to sexual violence. Coming in for second year funding from the Sonoran Center at $72,414. I'm going to hand this one to John.
Okay, thank you, Marcy. First, I want to preface this by saying that as Marcy has just shared with you in recapping the other two proposals, as I think we have shared in the past, and we will certainly share, even more today, we have great relationships with the USEDs. We are incredibly pleased with the work that the USEDs have done under contracts with the council, and generally speaking, we are typically overjoyed with the progress that those projects make. The one we're going to talk about now is perhaps an exception. As many of you know, the work that has been done, since 2018 around sexual violence in Arizona, the council has been a leader in this, and the council has invested a lot of money in various projects related to prevention and response to sexual violence. We have a project currently under contract with the Sonoran Center to build upon the work that Dr. Lynn Tomasa did several years ago, also under a grant from the council, to explore the lived experiences of individuals with IDD who have been victims of sexual violence, sexual harassment, sexual abuse, but also to look at the role of professionals in helping them and look at some of the system barriers that have prevented us as a state from being better at responding to sexual violence within the IDD community. The proposal that we received, the renewal proposal that we received based upon this current project, it left us with a number of questions. And we've had conversations with JC going forward about this. We've had conversations with Dr. Tomasa going forward about this. We did not feel, I guess the long and short of it is, we did not feel that at this point the renewal proposal was in a position where we could recommend it as staff for renewed funding for the coming year. However, we do believe that changes can be made to this proposal so that it can and will be something that we feel confident about pursuing into a second year. And I hope I'm making sense. I realize I'm not providing a lot of details, but this was a project that when we initially issued the contract, we thought was going to rely quite heavily upon Dr. Tomasa's report on lived experience to then translate into a significant body of public policy work related to response to sexual violence. As presented, we think that public policy element is not as significant as it should be, that there are some other elements to the proposal that maybe could move a little bit to the background and bring the policy a little bit more to the foreground. And so through the council's executive committee last week, we had a long discussion about this. And again, we've had discussions with JC over the course of months about this project, and the executive committee granted approval for us to move forward with a conditional approval of renewal, but contingent upon further review of the proposal, further modification to the proposal, and spending some time to really massage it in a way that makes us, again, as staff, a little more comfortable with the approach it's going to take in year 2. I will read for you the motion that was passed by the executive committee, and that was a motion made by JJ Rico to approve the Sonoran Center's collaborative approach to better respond to sexual violence in the amount of $72,414, contingent upon modifications made to their proposal as guided by the executive committee through staff to achieve outcomes the council is seeking. The motion was seconded by Kathy Lewandowski, and the motion carried. So again, kind of the long and short of it is the executive committee has conditionally approved this, so we don't need to take a vote of the full council today. But we will continue to work with JC and with members of her team to make some additional modifications to this proposal, and we will report back to you and to the executive committee in November on the progress. But we are anticipating that the contract will take effect on October 1st, and it just the final form of the renewal project is not quite there yet. So I hope I've done justice to that. Marcy, please feel free to jump in if I've left anything significant out, or JC, if there's anything more that you wanted to address on that.
I do not have anything else to add. Thank you.
Oh, yes.
For policy.
That is a good, I should mention, ACES-DV, which is the Arizona Coalition to End Sexual and Domestic Violence, is a partner on this renewal project. ACES-DV does a lot of work not only in supporting services for survivors of sexual violence and domestic violence around the state, they also do a lot of work in public policy. And so they have been brought into the project as the policy experts, and they will be leading the policy element of the project moving forward, which as we look at it now is designed to pursue some legislative solutions as well as some agency level solutions to the problems that have been identified, or the challenges that have been identified. So it is important. Thank you very much, JC, to mention that ACES-DV is going to be a significant player in this work going into year 2.
Thank you, John. Raina, you have your hand raised. Go ahead.
Yes. Just because there's, I'm sorry, I'm trying to come off camera. There is a focus specific to looking into DES investigations, and I'm assuming APS investigations, John. I know there has been some reach out to one of our administrators, Lisa Sarno, would like to converse more about the expectations and how we can support the identified outcomes that you've mentioned that will likely lead to some recommendations for APS investigations.
Absolutely. Absolutely.
Is there any further comment on this? And just to be clear, we're not taking a vote on this specific grant. John read the motion to you. They're going to go ahead and move forward, and we may need to bring it back, but they'll have approval from executive committee, which we can do when we run into some funny circumstances like this. And everything that we're hearing today on these grants, the new ones and the renewals, everything has already gone through executive committee. Okay. All right. Let's move on to agenda item F. Our contract and grant renewals are not grant renewals, are new approvals.
Okay, this is Marcy Crane again. I'm going to cover the first two, and then my colleague Michael Leva is going to cover number 3 and number 4. So the first one on the new proposals that were submitted in, it's going to be from Northern Arizona University Institute for Human Development, called ADDPC, or Assistive Technology, Building Readiness, Inclusion, and Direction for Goals in Education. This is a proposal for $50,000 to expand a lot of work that they have done around assistive technology for high school students, college students. We have funded approximately almost 2 different types of contracts with them to provide assistive technology, and it's been great. They've had a lot of good success with that. This one is going to bring it down to a high school level, so I will go over the summary about what ADDPC will do. So it's a 1-year initiative designed to improve post-secondary education outcomes for Arizona high school students with IDD that live in an underserved, rural, low income, and tribal community, either in Coconino or in Yavapai County. They are ADDPC plans to partner with, obviously, Arizona TAP that will provide them with hands-on AT assessments, training, and support to build their skills that will lead them to transition to college or vocational training. They're going to partner with 2 to 4 different high schools, as stated, in Coconino and Yavapai County, to include outreach to tribal schools. They plan to recruit a minimum of 8 high school students, either in the 11th or 12th grade, and they want to ensure that the target focus is geographic and culturally diverse. The schools would then identify the students in either 11th or 12th who would benefit from assistive technology to support their academic and transition goals. Each student will receive individualized assistive technology consultation, personalized training, and ongoing coaching that is designed to support their academic success, their independence, and achievement. For the success of this program to continue and to be sustained, IHD staff will collaborate with special education teachers for school staff to ensure they are supporting their goals or programs. Another positive is that 3 students from the previously council-funded program called Atlas, who have successfully participated in this program, these are college students, will be AT ambassadors or peer mentors to support the participants and to share their own experiences that will foster engagement, promote inclusion, encouragement, and confidence. IHD has a robust evaluation process to measure the AT usage patterns, their academic participation indicators through self-reports and interviews. They plan on tracking the progress of the IEP of their goals that the students have. And then other data points include student-reported confidence levels, family and school feedback on this project, as well as the school readiness to sustain AT practices after the grant funding ends. IHD project team also will develop recommendations for sustainability to sustain and potential statewide replication of this project. This will include a written summary of the lessons learned, examples of best practices, and development of a toolkit that other schools can use to implement a similar initiative. Are there any questions I can address?
Okay, no discussion? All right, thank you, Marcy. Hearing no further discussion, I'm going to call for a motion to approve the grant for assistive technology building readiness, inclusion, and direction for goals in education, ADDPC, by the Northern Arizona University Institute for Human Development in the amount of $50,000. Do I have a motion?
Aye, Sophie.
Thank you, Sophie. Do I have a second?
I'll second it.
Thank you, Monica. All those in favor of approval, please say aye. Aye.
Aye.
All those opposed, please say nay. And is anyone abstaining?
This is Kelly. I'm abstaining.
Thank you, Kelly. Okay.
Thanks, everyone.
Thank you. Motion carries. Thank you, Marcy.
Thank you. Okay, my last one, and then you're done hearing from me. Thank you.
All right.
All right. Excited to report this one too from the Sonoran Center. This is to continue supported decision-making, which has been a really big focus of the council since before legislation, through trying to get legislation and the passage of it. And this is for support decision-making training for physicians and healthcare system leaders. The project lead is going to be Dr. Tamsin Bassford, and she submitted this proposal to our office for $35,000. This will be under the self-determination goal. The Arizona legislature back in June 2023 did pass support decision-making legislation signed by the governor. And a key partner of this program is the ARC of Arizona that's going to be partnering with Dr. Bassford. They plan to expand the knowledge of SDM for a key group of professionals, which is really needed, physicians and healthcare system leaders in Arizona. They will center this on a couple of 5 key areas that I'll explain in a minute. One of the key things that Dr. Bassford illustrated in her proposal that I would like to just say verbatim is she quoted, "Practicing physicians and other healthcare providers are not well educated or trained about the legal issues surrounding transition of children with IDD in adulthood. They have not been trained to discuss support decision-making with their patients or to utilize an agreement when presented. Furthermore, physicians and other healthcare providers face systemic barriers, including a lack of policies and guidelines by their own organizations about support decision-making and how it relates to existing policies on consent or HIPAA, or where to store an SDM agreement in the medical record." So this project is to address this whole barrier that she understands and her perspective from. So it'll be carried out in 5 steps. The first one is they plan to conduct an SDM physician survey of Arizona physicians and health organization leaders to understand, first of all, their knowledge, attitudes, and behaviors, and their policy workflow barriers regarding support decision-making. She plans to conduct an additional 3 interviews, one with a practicing physician from Banner Hospital in Tucson, a second interview from a federally qualified healthcare center in Tucson, and then the third interview will be either with the chief medical officer or director of nursing, also from Banner in Tucson. The second part of that is when she has all this data is to complete an SDM readiness report, which is all the data she has collected from this survey and her interviews, and to identify the gaps in knowledge and attitudes and behaviors of the practicing physicians, as well as the barriers to implement SDM. From there, she plans to make sure that our office receives a copy of this so that we are aware of it as well. The third part of this is to create a PowerPoint slide set on support decision-making for physicians as a pilot test. And then she's going to take feedback and update the PowerPoint in order to have it ready to present to 15 trainings, and she's targeting practicing family physicians, family medicine residents, and she is also going to work with her contacts that she knows within, that she's affiliated, that she knows. So from the PowerPoint and from the feedback, this will be part of the last 5 months is to conduct training. She will collect survey data after every training from each participant, as well as any sort of informal conversations that she has. The last part of this after her trainings is she plans to develop a work plan to address systems barriers to support decision-making in the final report, feedback from the survey responses she sees in this final work plan, and then potentially how this can be supported by the council for future consideration in the next 5-year plan. So it's kind of an ambitious timeline, but we think that the Sonoran Center has with Dr. Tamsin's lead as well as JC's team to carry these activities out for the next year. Again, this is for $35,000. Questions?
Go ahead, John.
Thank you, Melissa. I just wanted to tag on that. As you all know, the council has supported SDM work for a number of years. We funded the ARC of Arizona for a lot of work, and Disability Rights Arizona for a lot of work to get legislation passed. And the implementation is ongoing. The education of the community is ongoing, but it's a painstaking process. And among the professional communities that need to be educated about supported decision-making, the 2 most challenging communities are financial services and healthcare. So if there's anybody who understands supported decision-making and the role it can play in the healthcare system, it is Dr. Bassford. I am very enthusiastic about what she can accomplish with this grant. It is ambitious, as Marcy said. There's a lot to accomplish in the course of a year, but she's well connected and she's well placed and very, very well informed about supported decision making. So I think it's fantastic, and the more we can do to educate healthcare professionals and healthcare systems who, no surprise, are always worried about liability, the more we can do to educate them about the realities of supported decision making and how it can be successfully and appropriately implemented in the healthcare environment, I think the better for them, and obviously the better for individuals with IDD who are using STU. So I just wanted to tag that over.
Thank you, John. Well said. JJ, go ahead.
I'll just second John's sentiments, and I'm probably preaching to the choir, but I have my younger son, as some of you know, has a developmental disability, and he just turned 18, and we've used one of the forms in the our materials that just went out, the legal options manual, and that has been challenged and interesting. Obviously, I don't know who they're dealing with, but it's important because this healthcare provider, it was insistent that the form and the information we provided was not sufficient. So the healthcare field needs a lot of educating, and I'm happy to see that there's folks dedicated to that, because that is a big barrier, and especially for us who have kiddos with complex needs and healthcare needs, access to portals and other things that you can use a supported decision-making form for, or other legal options short of guardianship. There's a lot of education is the point still to be had. So I really think this is a huge lift, but one that's needed. So obviously we support supported decision-making 100%, and this just furthers that educating of a population that I think needs some educating, and just wanted to highlight that real life example that even the Disability Rights Arizona attorney gets pushed back on some of this. So it's not, we all have those experiences. So.
JJ, thank you. I appreciate that. I'm sure we all do. I haven't had pushback. I'm in a similar situation. Both of my boys, who are now young adults in their 20s, also have complex medical needs as well. And so it's been interesting to navigate the system, but I have not run into roadblocks yet. But if I do, I'm going to call you. So we're all good there. And finally, one last thing. We often are quite aware of what's going on within our community, the work that's been done, the policies, all these things that come up within the IDD community. We know, right? But oftentimes the people who don't know and who need to know, and namely financial people and medical people in this case, really, really need to know. As I'm sure JJ's running into, it can be a roadblock, a barrier, a massive headache when you have to make some decisions with your adult child, and they're in agreement and you're getting pushback from their providers. So this is fantastic. I'm so excited because I remember where supported decision-making started and the battle to get that legislation through, and where we are today is pretty significant. So if there are no further comments or questions, I'm going to call for a motion to approve supported. Hang on one second. I have to voice the whole motion first. Thank you. Like your enthusiasm. So the motion to approve for supported decision-making education for the healthcare system, University of Arizona Sonoran Center, in the amount of $35,000. Do I have a motion?
Aye, Sophie.
Thank you, Sophie. Do I have a second?
I second.
Okay, I think I heard JJ first. Thank you. I think Mateo was the right behind you. Thank you both, gentlemen. JJ, all those in favor of approval, please say aye. 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 All those opposed, please say nay. And is anyone abstaining?
Yes, this is JC.
Thank you, JC. Okay, motion carries. Thank you. All right, our last two with Michael.
Thank you, Melissa.
That.
This is a proposal submitted by the Sonoran Center for Excellence in Disabilities The name of the project is Conducting a Statewide Needs Assessment and Environmental Scan to Promote a Sustainable DD Navigator. The proposal is for $35,000 and it aligns with goal number 5, system access and navigation. The goal of this project is to conduct a needs assessment and environmental scan to understand the potential, professional scope, context, responsibilities, and sustainability of DD navigators to act as a liaison and advocate for refugees with disabilities. Approximately 20% of refugees have disabilities. Previous research indicates that they are not connected to the services they are eligible to receive in the state of Arizona. Both individual and systems level barriers influence refugee access to disability services and supports, including lack of clarity about disability services, inability to get the support needed to pursue education and employment, and lack of linguistically appropriate services. The Sonoran Center proposes to work closely with stakeholders, such as the International Rescue Committee throughout Arizona, to conduct an environmental scan and needs assessment to inform the implementation and sustainability of refugee DD navigators. Since refugee resettlement has been halted by the federal government as of January 2025, the environmental scan will enable the Sonoran Center to understand the current landscape of social services for refugees with disabilities and help collaborators plan. Statewide, the Sonoran Center will evaluate needs related to disability information for refugees and existing infrastructure among organizations, for example, councils on aging and federally qualified health centers that serve refugees. Project activities include the following: conduct a review of national and state policies that would support a DD navigator, identify existing community health worker trainings related to disability, identify organizations statewide who employ community health workers who might interact with refugees with disabilities, for example, federally qualified health centers, councils on aging. And the last, conduct a statewide needs assessment related to DD navigation feasibility, acceptability, and sustainability. Project activities will result in the following 3 deliverables: a policy brief, a resource guide for disability training courses for community health workers, a report on the findings from needs assessment. Deliverables will be disseminated on the ADDPC and Sonoran Center websites through investigator networks and in peer-reviewed journals, that is, policy and health journals. Lastly, the current federal administration has limited refugee resettlement and will implement new eligibility requirements for public program, for example, Medicaid Supplemental Nutrition Assistance Program, that will limit access to services for refugees who have been resettled and who are not yet legal permanent residents or are not citizens of the United States. The environmental scan and needs assessment will help the team identify potential connections, collaborations, and create responses to a gap in federal funding and build the evidence base for implementation of refugee DD navigators locally or at the state level. In the long term, the DD navigator model may help buffer the loss of access to certain federal programs for refugees, while also building capacity and connections for when those programs become available to refugees again. Are there any questions?
Okay, we have a quiet council this morning. It's Friday. All right. If there are no comments or questions for Mike, I am going to call for a motion to approve the statewide needs assessment, Refugees with Disabilities Project, University of Arizona, Sonoran Center, in the amount of $35,000. Do I have a motion?
Hi, Sophie.
Thank you, Sophie. And I heard somebody that was going to do a second. Who was that?
Now me, I was
Thank you, Monica. Monica is our second. All those in favor of approval, please say aye.
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 All those opposed, please say nay. And is anyone abstaining?
Yes, this is JC.
Thank you, JC. I got to ask every time.
Raina's abstaining as well.
And Raina, okay. Raina, thank you so much.
Thank you.
Okay, thank you. Motion carries. All right, Mike. Number 4, our last one.
Thank you, Melissa.
Yep.
This proposal was submitted by the Sonoran Center for Excellence in Disabilities. It's titled DESP Impact Initiative in the amount of $35,000, and it aligns with goal number 2, meaningful careers. The Sonoran Center is requesting $35,000 from the council to implement key recommendations from the 2024 Direct Employment Services Professionals Survey. This effort, the Arizona DESP Impact Initiative, builds on a strong data-driven foundation developed in collaboration with ADDPC, the Arizona Association of People Supporting Employment First, APSE, and the Colorado Office of Employment First. And when I talk about DESP, I'm referring to direct service employees, but really the people at the ground working with people with disabilities, and those are job coaches and job developers. This proposal offers a detailed and actionable plan to support the professional development of DESPs, fill identified training gaps, strengthen the service system through ongoing structured collaboration, and offer meaningful support for disability employment professionals, provider organizations, and the systems that support them. All activities will be grounded in best practices and developed through ongoing stakeholder collaboration. Each objective includes a real-time feedback loop to ensure emerging deliverables meet community needs. The first objective, the DESP survey findings indicate that disability employment professionals want quality training and cost is a barrier. This objective will create a certification support fund pilot to gauge interest and follow through with certified employment support professional CESP training and credentialing through national APSE. The Sonoran Center will partner with Arizona APSE to support a small group of Arizona employment professionals in pursuing the CESP credential. This pilot will test whether organizations are willing to support certification if funding is available, and will explore what types of assistance DESPs may need during the certification process. Outcomes will include developing and testing an application process, developing transparent vetting criteria to determine who will receive funding, launching the application statewide, developing marketing and outreach materials, and ensuring equity and representation across providers, including provider type, area served, population specialties, and cultural diversity. The fund will be developed to reimburse application and exam fees totaling $199 per qualified and selected applicant, with the goal to support 5 to 10 professionals with this process. The second objective is to develop and launch on-demand foundational trainings for DESPs, again, job coaches, job developers. While objective 1 is intended to increase access to certified credential opportunities, a generalized training gap will still exist. Within this project, the Sonoran Center will develop additional resources for the training and education of disability employment professionals in Arizona. The Sonoran Center will develop and pilot 3 on-demand onboard trainings to support new and emerging employment professionals in Arizona. These training modules will focus on the 3 most requested topics identified by the DESP survey: systems navigation, disability employment policies, and providing culturally responsive employment services. These modules will include self-paced videos and links to resources. Training will be accessible for all learners using universal design principles. Each training module will be user tested by 5 to 10 disability employment service professionals with feedback incorporated into the modules before they are released to the public. Project partners will provide technical assistance in the development and evaluation of the modules. Lastly, this project will fund efforts to formalize collaborative engagement across stakeholders, invest in developing needed infrastructure, and provide opportunities to engage potential employers while ensuring that systemic barriers are addressed. Outcomes are designed to be the foundation level investments that can be sustained and scaled to meet the unique, diverse needs of disabled job seekers across the state. The efforts of the Arizona DESP Impact Initiative will strengthen Arizona's disability employment system, expand professional development opportunities, and lay the groundwork for sustainable, scalable improvements that advance competitive integrated employment. Are there any questions?
Okay. No comments and no questions. Hearing no further discussion, I'm going to call for a motion to approve Direct Employment Support Professionals DESP Impact Initiative by the University of Arizona Sonoran Center in the amount of $35,000. Do I have a motion?
Aye, Sophie.
Thank you, Sophie. Do I have a second?
I second.
Thank you. I need to see who that was. Mike. Okay, thank you, CJ. Thank you. You'll have messages in. Raina, I heard you there. You've got to go, but she's abstaining.
Thank you.
You're welcome. Thank you, Raina. All those in favor of approval, please say aye. Aye.
Aye.
Aye.
All those opposed, please say nay. Is anyone abstaining besides Raina?
Yes, JC.
Thank you, JC. Okay, thank you. Motion carries. All right, thank you. That was quicker than I thought. It's hard to sit through 7 of those, but thank you so much for your patience and your interest. Yay. Let's move on to agenda item G, our committee work group reports. Our first report out will be from Monica, our grants chair.
We haven't met for a while, since the last council meeting. And a lot of the council members that are on the grants committee are also on the executive committee. So we haven't met.
Okay, thank you, Monica. But in lieu of going through the grants committee, as you just stated, everything has gone through executive committee. So, and we do on executive committee have representatives from all of our committees on there. So that's a little helpful when grants can't get together. So thank you, Monica. Thank you. Thank you.
Excuse me.
No problem. Okay. Next we'll hear from Jana Merle, our System Access and Navigation Committee Chair.
Hi, thanks, Melissa. Just like Monica, our Systems Access and Navigation Committee has not met since our last meeting. So we need to, we intend to reorient to the work prior to our next council meeting.
Okay. Sorry, guys, give me just a second here. All right. We did have an opportunity to meet. Pardon me a second. My notes are very, very slow to open here. Good thing we have extra time because there was minimal discussion on our grants today. Sorry. I do better with my notes on this one so I don't miss any important details. And my computer is very slow today. Come on. You guys didn't have anything else to do today, right? Okay. So for Mike, I'm going to restate our goal in case you're not familiar with our Committee of Meaningful Careers. Our goal was that by federal fiscal year 2026, ADDPC will increase the career potential of people who have intellectual and developmental disabilities, IDD, and link them with resources needed to achieve their career goals. This will be very short and sweet today. The Meaningful Careers Committee is exploring supporting a new project search site by providing funding for the licensing fee for the program. I believe that amount is $17,000. And then once a site is licensed, it will, the site themselves, it's minimal. It's a fraction of that amount yearly. So it's definitely manageable if they continue being a project search site. So Mike and the Sonoran Center project search team met with the West MEC and about the possibility of launching a high school level program. So additional meetings are planned to discuss the implementation of a comprehensive launch plan to secure the business site that will most likely be Banner Estrella Hospital. They'll develop a formal partnership and a project search implementation plan if everything goes well. Just to clarify, West MEC is Western Maricopa Education Center. It's a public school district that provides innovative career and technical education, or CTEs, you may be familiar, programs, and is partnering with 15 public school districts and 2 charter districts. So we'll keep you posted on the project search site, and we are currently wrapping up fiscal year 2025 activities, and we're looking forward to fiscal year 2026. Thank you for your patience. Yes, Kristen.
Just wanted to remind folks when engaging on the project search activities, the annual fee is one piece of it, but typically speaking, most of those students then come to VR, and VR is a portion of the payer source for that. So I wasn't sure how that communication had happened, or if it had happened, or if it was anticipated with this one, that these would be VR clients that would then also be supported in terms of cost.
Okay, I think that is a Michael Leva question. He can address that one. Mike, are you able to respond to that?
Yes, these are preliminary right now, Kristen, and so definitely we will involve VR. And when I had that discussion with them, I said that the participants must be VR clients. So we are making sure that that is part of the process.
Right. I would just ask that in the future, before engaging on different activities, that we would be able to have some insight into that as well. It helps from planning to make sure we have enough staff and enough resources to do that work on those activities as well. So, but we're aware of this one, and we'll go there. And I think I'm not certain where the ASDB one fell, but I think those are 2 that have been pursued, and we're kind of catching up to that information. So if we could just kind of be on the same page moving forward, that'd be great. Thank you.
I appreciate that, Kristen. And just quickly, originally we had contacted the Mesa Public School to as a potential project search site. And while they were very enthusiastic and wanting to participate, because of dwindling enrollment, they had major staff cuts. Over 100 staff were eliminated. Our big champion, Martin Apple, that transition guy that's been around forever, was let go. And then the transition specialist director was also laid off. And then what we did is we went to the Kingman Unified School District to see if we might be able to establish a site in a rural community. While they're very enthusiastic and wanting to participate, it's interesting, they had too many individuals who they would consider to participate in the program, over 20 students, and that would require 2 faculty or 2 educators, and they didn't have the budget for that. So what I wanted to do is explore how we could work quickly with an organization. Since WestMec has 2 existing project search sites for adults, we thought that maybe a high school program might work. So again, Kristen, these are preliminary discussions. I apologize that I didn't fully brief you on this, but absolutely VR will be, they have to be at the table.
Yep. Thank you. Appreciate it, Mike. And sorry, I have to jump to another meeting, but appreciate the conversation. Thank you.
Thanks, Kristen. Okay. Oh, Mike, Vijette had a comment. She's asking about Havasu, the Lake Havasu area.
We hadn't we didn't have discussions with Lake Havasu, but are there individuals in that area, Vijette, that you believe would be interested?
Absolutely.
Okay, I will follow up with you after this meeting.
Okay.
And if you can facilitate some introductions, I would appreciate it, and I'll definitely reach out to them.
Cool.
Thank you. And it's such a shame about Kingman because, you know, within our valley, we obviously have a lot more resources, and even down in Tucson, but boy, those outlying areas, they need this so bad. They're so underserved, and I'm sorry that they couldn't even do half as many students. I mean, maybe they just didn't want to have to make the decision of who to choose. But that's a shame. Maybe in the future they can make that work because they need it more than ever out that way. Okay. Thank you.
Thank you, Vijette.
Yeah, thank you, Bajette. That's pretty cool. Okay, that is all from me. Let's move on to behavioral health and IDD work group with Jason. Thank
All right,
you.
that's me. So this will be short because, but the behavioral health and IDD committee looks to improve interactions with people with disabilities and within the behavioral health system here in Arizona. So we meet monthly, once a month, and we missed our last meeting, but the meeting before that we talked about the President Trump's executive order that was signed back in July, having to deal with individuals in mental health. And then we also talked about forming a group of people to address the healthcare system here in Arizona, particularly around behavioral health. And that's still, we're still trying to form that. It's you know, increasingly important with all the stuff that's coming down the pipe, state and federally wide. So that's pretty much my update. If anybody has any questions, I'm happy to answer them. And that's it.
Okay. Thank you, Jason. Okay. And finally, our last committee report out from Kathy Lewandowski, the chair of the Work Plan Review Committee.
Good morning. So our committee, the Work Plan Review Committee, met on July 31st, 2025. And we reviewed the final proposal at the fiscal year 26 annual work plan proposal that we are required as a council to submit to ACL. And it was presented by John and Marcy and other staff. And they talked about the objectives and the activities, the changes they made to the objectives, any additions or deletions, and the proposed financial commitment and grant and contract timelines. If you remember, there are 5 goals that we work under in our work plan. It's self-determination, meaningful careers, inclusion with engagement, safety, system access and navigation. And under each one of those, there are objectives and activities. And today, we've approved some new activities or extensions of activities and through contracts, etc. Our annual work plan is due to ACL by August 15th, 2025. And it's for the period of October 1, 2025 to September 30th, 2026. I think John mentioned that I don't think we've received approval yet of our work plan, but I just wanted to say that, you know, I think we had to make some tough decisions knowing with some of the uncertainty going forward, but I think we've got a good work plan. Our staff are working really hard. And if you have any questions, you know, ask John, Marcy, Lonnie, any of the staff regarding the work plan if you've had a chance to look at it. And that's my report.
Okay. Any questions for Kathy? Okay. I want to thank all of our committee chairs because you do have to put in work and make sure you're extra available as well as committee members. And I'm really, Kathy, I'm familiar with all of them. I sit on all but one of these. And I got to tell you, I think yours sometimes is the most challenging because there's so much that you have to be aware of and dive through. I'm really grateful for your leadership and your background. and heading an agency. So thank heavens you have brought some things up that didn't occur to me and perhaps some of the others. So thank you very much for what you're doing there.
Well, thank you. I enjoy it. I really do. I love working with this council.
Thank you. I do too. So thank you all so much. Okay, moving on to agenda item H, our announcements. Does anybody have anything to announce today?
I do.
Okay, Sophie, go ahead, and then we'll hear from John.
My theater company is doing Animal Family, and I'm glad to say I got the lead in the show. I'm so excited. John has to be there no matter what. So come, it's the weekend of January 8th, 9th, 10th, and 11th. And I will share more details when it gets closer.
Okay. Congratulations, Sophie. That's
Thank
pretty.
you.
That's
Sophie.
Yeah.
Thank you. John, what do you have to say about that?
We'll come see you.
Yeah, that's great.
Okay, good.
That's amazing. Congrats.
Wendy has to come too.
All right. Okay, John, go ahead, sir.
All right. Well, first of all, I want to say I am shocked, amazed, and somewhat disappointed that Sophie didn't mention that Taylor Swift's new album gets released next Friday.
I
Why?
love you, John.
All right. So I've announced
I love
that.
you, and it's my
I know. I wanted to circle back to the question Sophie asked about the changes to access and DDD eligibility, because I probably did not explain that well enough. By way of a little history, and forgive me if you already know this, but during the 2025 legislative session, we know that DDD was facing a $120 million funding shortfall. And there were long and sometimes acrimonious meetings and hearings and protests and all kinds of stuff around the need to provide that supplemental funding in order to keep the system solvent through state fiscal year 25 through June 30th of this year. What happened, as we all know, is that the legislature finally reached a compromise bill within the appropriations committees and with the governor's office, so that $120 million supplemental funding was provided. But as part of the legislation, they required that DDD and Access go back to the drawing board and come up with a new eligibility assessment tool specifically for the 0 to 17-year-old population, because the largest caseload growth, the largest increase in costs for the state for DD services are in that age range. And some of it has to do with the Parents as Paid Caregivers program. That's not the entire reason for it, but that was certainly what got latched onto by the legislature as the culprit in all of this. The fact is, it's a variety of factors, and the legislature just said we're only going to be able to provide so much, and the federal government, we know, is going to be cutting back on its Medicaid funding, so we have to come up with a better tool that that limits some eligibility, or this system cannot stay afloat. So what they did, and they were given an October 1st deadline to do this, what they did was go back, between May 1st and now, or May 1st and a couple of weeks ago, they reached out to the community. They did all the things they have to do by law in order to come up with a new assessment tool. And now, starting October 1st, that assessment tool is going to go into place. What it means is, and again, this is for the 0 to 17 age range. I've spoken with Zane Garcia Ramadan at DDD, and he said that essentially this is not going to affect adults with IDD at all. For all intents and purposes, they are safe. They're going to continue to receive what they've always received. But for the adolescent and the child age ranges, what we are likely to see is that the range of services provided to people, or the amount of services provided to some members, is going to significantly reduce, and parents who are currently being paid as caregivers are likely to see the hours they're allowed to serve as a paid caregiver dramatically reduced as well. All of this is in an effort to make sure that the system can pay for itself. And as Zane said to me, the system will still be providing 4 times the level of services that it provided pre-pandemic. Now, I'm not really, I'm just not smart enough to understand all the ins and outs of that, but that is a quote that from a meeting he and I had recently. 4 times the services. Arizona will continue to be a very generous service system when it comes to DD services, perhaps the most generous in the nation. But some of these cuts, in the view of the legislature, and I think from a fiscal standpoint, are just critically necessary in order to keep the system afloat. Now, as I said earlier, it's going to affect a lot of people, and it's not going to, for a lot of people, it's not going to make them happy. We're hearing about this already. It's been in the media. There are calls to have the implementation delayed. There are calls to have some of these rules changed. But we have to look at the law, and the law says that these limitations have to go into effect by October 1st. So that's what we're looking at. It's not to say that some things can't change. The governor's office has a lot of authority here and could, you know, they could rescind some things, they could delay some things, but it doesn't look like that's what's going to happen. So I hope that's a better explanation. Again, it's really gonna affect the population of 0 to age 17 and the parents who are being paid as caregivers right now. It's much more complicated. I'm really oversimplifying it, but the reality is, it's just, we're going to see some service cuts. We're going to see some hours cut, and it's going to affect some people financially. It's also going to affect some people in terms of the care they get from the state. But at this point, it sort of looks like there's no way around it. I'm happy to answer any questions if you have any. I think probably most of you are pretty familiar with what's going on already.
No, thank you, John. I think that was a good explanation, as good as we could have. And the reality is that the number of young people being diagnosed with intellectual and developmental disabilities, it has skyrocketed in a number of areas. That's just a fact. Autism is a big one of those, whatever the reason. And we have so many people that move to Arizona because of our services, right? And as our industries grow, as business sectors grow here, families move here, and then those people may have kids that are diagnosed with something. It's not sustainable as it is. I hate that we're having to make the changes, but what else can the state do, right?
Well, to that point, I would say the one thing the state can do is appropriate more money to the system.
Well, yes.
But that is a decision that our legislators have to make. So if there's anything we could advocate for right now, and what we've been advocating for year after year, is a greater investment in the DD service system from the legislature. But beyond that, I mean, we don't know if the Medicaid cuts that are supposed to take place in January 2027 will take place. We don't know what the overall impact of that is, but the legislators feel it's their job to plan for that. And so they don't want to be caught, you know, on their heels when that comes to pass. And this is part of the planning for that, as well as just looking at current need and current available dollars.
Understood. Thank you. Sophie, did you have a comment or a question?
Yeah, I was waiting for when John would answer that question about the comments with DDD.
Yes, and that was his answer. He just
Okay,
gave.
cool.
Okay, I hope that made sense.
Yeah.
If you've got any more questions for him, Sophie, you can always follow up with John after the meeting or later about it too, if you want more information.
Okay, cool.
All right. Thank you for clarifying that, John, and thank you for the question, Sophie. Are there any? Thank you, girl. Are there any other announcements?
That Taylor Swift's coming out with an album October 3rd. And John, I hate that you called me out for that, because you do not know your Taylor facts way more than I know my Taylor facts. So you better watch out, John.
All right, John, beware. So now we
Don't
know.
be Taylor Swift trivia, John, at Question Bottom at 6:30, and you're gonna lose.
All right. Well, beware, sir. All right. Are there any other announcements? Okay. Moving on to agenda item I, a call to the public. I did note at the beginning of this meeting, we did have some people on. Hey, Justin. Justin just commented he's glad that Sophie's excited about about Taylor Swift. Justin is on our list of people to be approved for the council. So Justin, thank you for being able to join us this morning and keep current on what's going on. Are there any comments or questions from the public? No, but Vijay just made a point of saying Justin is awesome. And yes, he is. I fully agree. We're excited to have him on here. Okay. If we have no more activity, oh my goodness, there's debate in there. Yeah. Justin says he's not as great as Vijay. All right, guys, you're all awesome. Let's just state that right there. I am going to adjourn this meeting. Thank you all so much.
I'd like to make a comment.
Oh,
comment.
Mr. Delgado.
Hello. Good to hear your voice. Go right ahead before we adjourn.
Okay. I'm up north, advocate, parent support, and I'm for a long time. And what I want to find out is, has there been any change developing? But I hear there is something developing that is good, and that's in reference to the sub-minimum wage for our clients out in the community and employers. Instead of paying them and getting away from the 14C, that sub-minimum wage. 22 states had completed it. Colorado, Alaska, and California just completed it January 1. They got away from that sub-minimum wage, the blue certificates. And but instead of paying that $7.20, instead of paying that sub-minimum wage and being mandatory for $7.25, it's now, and with a hope that we would be 23 states. Perhaps I should ask John on that one point, since he's pretty informed on mega areas. Has there been any new development in that regard?
He would know, and so would Mike. Mike, would one of you gentlemen like to? I don't know that there's any updates on that, but you are probably more informed than I am right now. Either Mike or John.
Mike, you want to take that?
Hello.
John, I thought you could mention what NACDD is recommending for the executive directors and for councils.
Sure. Well, first of all, I would say, Mr. Delgado, that there was a proposal in front of the Department of Labor, the U.S. Department of Labor, to completely eliminate sub-minimum wage. That proposal was put into place by the Biden administration. This summer, it was actually rescinded or removed by the new leadership at the Department of Labor. So from a federal level, there is not a push right now. And in Arizona, there is not a legislative push, but the new rules implemented by Access and DDD related to employment programs offered by providers will require within the next couple of years that they stop paying sub-minimum wage. There was a fight, I don't know, it was like 20 years ago maybe, there was a fight to have 14C eliminated in Arizona. It was a very ugly fight within the disability community and not one that we want to revisit. But the new rules being implemented by the DD service system are going to require that that providers who offer employment programs stop using sub-minimum wage anyway. So within the next couple of years, we expect that's going to be invisible on the Arizona landscape. That's about the best I can tell you. Our national association, the National Association of Councils on Developmental Disabilities, is pushing very, very hard to see 14C eliminated. In fact, it has been a source of contention with some of our national partners around this issue. But it is, of course, handled right now mostly on a state-by-state basis, and we're just sort of letting the system proceed the way it does, and moving into the kind of environment that DDD is creating. I don't know if that's an adequate explanation, but Mike, if you want to add anything in, you certainly can.
I don't have anything to add right now, John.
I'd like to add one more thing, if I may.
Yes, Mr. Delgado, go ahead.
Okay, I received, I try to keep up on it from the Scoop Disability Association Advocates. They made a proposal to the Trump administration to request plan to end some minimum wage employment of people with disability. Now, that was submitted on last month, the 25th of July. It's in the process now, but it's going back and forth. And just like John was saying, it's kind of controversial. I don't know why it should be. And to eliminate, because 22 stations completed, we were hoping to have 23. We'll still pursue it accordingly, as we think, even to the legislature again in January, if we don't do it on level, as far as I know at this point. And it looks like with the Trump administration, he's doing a lot of things that seem most favorable. And I guess maybe it is our hope that maybe he will eliminate it nationwide for all these people, because the minimum wage is $7.25. 25 states have it. Arizona has not yet, but we're working on it. It's our hope that it will continue and maybe eliminate it in like manner. These people need, with cost of living, it comes January 30, we don't have enough money to pay this and that. We're hearing on the news. So it's going back and forth, but I think it's very important. That's all I have to say on that point. That maybe something new will be developed in favor. That's all I can say, and I hope so. That's all I have to say on this point, just to give you an update as I have it. Thank you.
Thank you, Mr. Delgado, as always, for your comments. We appreciate your attendance and keeping us informed. And I do agree with you. Thank you so much. Okay. I am going to adjourn this meeting at 11:52 a.m. Everybody have a wonderful weekend. All right.
Thank you.
You're welcome.
John, watch out.
Bye-bye.
Good meeting. Thank you.
Bye.
All right.
Mr.
Thank you,
Delgado.
goodbye.
Bye.
And I'm staying on to chat with Mike for a minute.
Yeah, is the recording off, or does it, how do we stop that?
It still shows that it's recording up there.
Let me see if I can stop recording. Oh gosh, where is that? Okay, here it is. Manage recording. Stop recording.
I don't